We're going to be considering the very diverse lives that deaf people live in low and middle income countries. The experience of being deaf is a complex interaction between personal and environmental factors. Individual responses to being deaf vary enormously according to age, gender, socioeconomic status, geographical location, sexuality, ethnicity, and cultural heritage. The deaf community includes deaf children, deaf youth, deaf senior citizens, deaf women, deaf lesbian, gay, bisexual, and transgender people, deaf people with disabilities, and deaf blind people. It also includes the children of deaf adults, many of whom grow up as part of deaf communities. The World Federation of the Deaf is the international organisation which represents the interests of deaf people internationally and at the United Nations. The World Federation of the Deaf is committed to the promotion of the full achievement of the human rights enshrined in the United Nations Convention on the Rights of Persons with Disabilities, alongside all other human rights treaties. Its vision is that deaf people have full human rights in an equal world where they and their sign languages are recognised and included as part of human diversity. The World Federation of the Deaf recognises that deaf people are an important and crucial part of humanity, with unique cultural and linguistic contributions to human diversity. Deaf children are born into wealthy families, as well as into families who live in chronic poverty in remote rural areas and urban slums. Deaf children born into economically poorer families are less likely to have their hearing loss diagnosed, have hearing aids fitted, learn sign language, attend school, and have access to digital forms of communication. Although having a hearing loss correlates with disadvantage, some deaf people are more disadvantaged than others. For example, people with more severe hearing impairments often experience greater disadvantage, especially in the workplace. This is shown by employment data in low, middle, and high income countries. Deaf girls and women experience the combined social and economic disadvantages associated with gender, as well as their deafness. They are particularly vulnerable to sexual abuse. Without spoken language, they have difficulty reporting what has happened to them. If they are able to report any abuse, their story is not always believed. In general, fewer deaf girls attend school than deaf boys. This may be because their families choose to keep them at home in order to provide essential domestic labour. In Bangladesh, for example, many parents are afraid to allow their deaf girls to walk to school for fear that they will be attacked and that this will ruin their opportunity to marry. We're going to talk about street-connected deaf children now in this section. There are significant numbers of deaf children who live street-connected lives. The majority are boys. There are no official statistics available, but there is plenty of evidence available from NGOs who support these children. Being street-connected means that children and young people move between living on the street and living in temporary shelters, or even occasionally returning home. The Undugu Society of Kenya trains community-based organisations to identify deaf children and young people who live both in the slums and the streets of Nairobi, the capital city. Where possible, they help to reintegrate them into their family homes and place them in local schools. Deaf young people who cannot return to their families and who earn their living by car washing or begging perhaps, are invited to participate in capacity building workshops and to learn independent living skills. Income generating opportunities are also provided by the Undugu Society of Kenya to the poorest parents of deaf children, some of whom are living on the poverty line of $1 to $2 per day. Many deaf people have poor literacy skills and so face difficulty in accessing written and spoken health education information. This means it can be difficult for deaf people to learn about health issues such as the importance of drinking clean water, the availability of mental health services, and of contraception and antenatal care. Deaf people are at greater risk of contracting HIV/AIDS because information about sexual health and AIDS is not always communicated in ways they can understand. This is especially true of those who live in remote rural areas. A deaf theatre company in Quelimane in Mozambique raised awareness of deafness and wider development challenges. Their ability to communicate key health messages through drama led to them winning a Ministry of Health contract to raise awareness nationally in Mozambique of the dangers of HIV/AIDS. This had the dual impact of raising awareness of deafness in general and of the ability of deaf people to communicate effectively through mime and sign. There are many other examples of deaf theatre groups which have effectively challenged negative attitudes and made a positive contribution to society. Many deaf children have been orphaned as a result of AIDS, but accurate statistics on the scale and impact of AIDS on deaf people have proved difficult to collect in low and middle income countries. Evidence exists from NGOs working in many parts of the world that demonstrates there's been a rise in the number of deaf orphans attending residential schools for the deaf. The death of parents due to AIDS is one of the reasons that some deaf children and youth migrate to urban areas and live street-connected lives. Diverse access to sign language services. The World Federation of the Deaf recognises that sign languages are part of linguistic diversity. However, access to sign language is not universal. Many deaf people learn to sign late in their lives. A survey on deaf people's human rights conducted in 93 countries found that sign language interpreting services exist in 62 of these countries. 43 countries have some kind of sign language interpreter training. 30 countries had 20 or fewer qualified sign language interpreters. These included Iraq, Madagascar, Mexico, Sudan, Thailand, and Tanzania. The World Federation of the Deaf is understandably concerned that a number of sign languages around the world are in danger of dying out, in the same way that many spoken languages are becoming extinct. Now going to think about diverse educational opportunities. It is not known how many deaf children attend school in low and middle income countries. It can be assumed, however, that only a minority of deaf children in low-income countries attend school, especially in remote rural areas. The World Federation of the Deaf recognises the importance of making parents aware of the linguistic human rights and cultural rights of deaf and deafblind children and youth. But raising parents' awareness requires knowledge, skill, funding and coordination. It's not easy. It also requires governments to have the capacity to respond to parents' demands arising from their increased awareness of these rights. However, such capacity is not always available. Now we have an example from Ethiopia. Jerusalem Inclusive School was established by Mr. Yihayez Chane and is one of CBM or Christopher Blinden Mission's partners. Mr. Chane is deaf. He is also the head teacher. The school includes children with and without disabilities who learn, play and live in an inclusive and diverse environment. Every teacher is able to communicate fluently in sign language. Community members are also encouraged to attend lessons in sign language. The Jerusalem Inclusive School now has a waiting list of learners wanting to attend. Uganda has had a progressive education policy since the late 1990s, which promotes more equal education opportunities for girls, for children from income-poor families, and for disabled children. Despite these progressive policies, it is estimated that only 3,000 of Uganda's 160,000 deaf children under the age of 15 attend school. In Tororo, the Uganda National Association of the Deaf has raised awareness of the exclusion of deaf people from CBR services. They devised a pilot project to teach CBR workers sign language so that deaf people could participate in their communities and recognise their full potential. Many adults who were born deaf and who live in remote parts of Uganda have never been to school. In Tororo, with the help of these deaf volunteer CBR workers, deaf people have been able to learn sign language in their own homes. The persistence, though, of negative attitudes towards deaf people and high illiteracy and poverty rates among deaf people and their families has made this work very challenging. Awareness-raising campaigns have been launched to encourage the government to mainstream deaf people's issues in their programs and budgets in Uganda, though. It is not known how many people become deaf as a result of war, are displaced as a result of conflict, or are living as refugees, either in their own countries as internally displaced people, or in neighbouring countries where they need to adapt to their new surroundings and learn new languages. In 2005, Kakuma refugee camp in Kenya was home to 90,000 refugees from 10 different war-affected sub-Saharan African countries. Each day, 22 Sudanese, Ethiopian and Somali deaf students attended lessons together in the unit for the deaf within a primary school in the middle of this very large camp. The Somali teacher was about 24 years old, and the students ranged from 8 years to 38 years old. The students were all learning at different levels in this multi-grade class. Some were learning for the first time, some were part of an accelerated learning program. Sometimes the older learners assisted the younger ones. Social studies lessons involved discussing how people could live together peacefully, as well as some mentoring for those who were traumatized by their experience of war and dislocation. The learners were grouped together in this way because of the lack of teachers with sign language skills in the camp. Efforts were made to train teachers from the different countries in Kenyan Sign Language. It was too difficult to teach in the many different home sign languages. At break time and during morning assemblies, the deaf learners were able to mix with the non-deaf learners. War and dislocation has had a major impact on the development of sign languages in the world. Great strides were made to develop sign language by Afghan refugees who lived in exile in refugee camps in Pakistan. Now mainstream teachers in Afghanistan have been taught Dari and Pashto sign language, using a dictionary with about 8,000 words. Deaf learners first undergo a home-based preparatory training, then join community rehabilitation development centres for at least 2 years, before finally they are mainstreamed in regular classrooms. Inclusive education resource persons make follow-up visits to schools to monitor progress. This lecture has highlighted some aspects of the diverse lives that deaf people live. I hope you are eager to learn more about some of the issues raised.